So, Dr. Jaydev, in continuation of our discussion on spine disorders and the various problems, we recently saw a patient with an MRI which said lumbar canal stenosis. What exactly does this mean?
So, lumbar canal stenosis, lumbar means the lower back. So, it pertains to the spine in the lower back. Okay, we all know low back pain, etc. So, this is the area of low back. So, here our lumbar spine has got a canal inside it. So, the word canal refers to that. And lumbar canal means canal of the spine here. And stenosis, what is the meaning of stenosis? Stenosis means becoming small, especially a circular structure becoming contracted. It is a stenosis. So the canal becomes small. So lumbar canal stenosis means a canal which carries nerves through it. And where do these nerves go? They supply the legs. They also supply important areas of pelvis. And the structures which are responsible for control of urination and defecation. These are all important structures. So lumbar canal carries a bunch of nerves which supplies very important structures, including those in the pelvis and the lower limbs. So if this canal becomes narrowed because of any reason, so it is a generic term, because of any reason it becomes stenosed, then the nerves get, one, mechanically compressed, and two, the blood supply coming to these nerves also reduces because the blood vessels around these nerves also get compressed in the canal. So lumbar canal stenosis means the canal becoming small. Now, there are multiple reasons for this. The commonest reason is spondylosis. Spondylosis is nothing but aging of spine. In this process of spondylosis, a lot of calcium is deposited within various ligaments within the canal, and the canal becomes stenosed over the period of time. Also, one vertebra slipping over another, called as spondylolisthesis, causes, again, canal stenosis because it disrupts the anatomy of the canal. Another thing that causes canal stenosis is a well-known problem of disc prolapse or disc herniation or slip disc. So the disc between the two vertebrae slips and comes behind, and it reduces the area of the canal, stenosing it. So the nerves inside the canal get very small space to reside in, and then the symptoms start in the lower limbs. So there are multiple such reasons for lumbar canal stenosis. I must add that some people have congenitally small canal, which means by birth the shape of their canal is small. Like someone can have a large ear, someone can have very small ear, even nose.
Or fingers can
be of different size. Similarly, congenitally, by birth only the size of the canal is small. In such people, if something else gets added on, like spondylosis or spondylolisthesis or disc prolapse or combination of all of the above, then the symptoms of the stenosis appear very early.
So lumbar canal stenosis is primarily a radiological term.
It is it is an anatomical term and very frequently reported in the radiological reports of MRI.
Okay. So what problems will the patient have if there is lumbar canal?
So lumbar canal stenosis, when it advances to critical degree, creates what is called as neurogenic claudication. Now, claudication, literally claudicare means to limp. So limping because of nerves, that is, this is the literal meaning of neurogenic claudication. Limping because of the nerve pressure or pressure on the nerves. So limping means what? In such people, they say that when they start walking, for first few steps or first few minutes, there is no pain at all. But after, let's say, 5 minutes or 10 minutes, the thighs, the buttocks, and the calves start becoming heavy. They start feeling numbness. They start feeling tingling in these areas. Sometimes even in perineum or private part areas, they start feeling tingling and numbness and heaviness. And if they continue walking, a point comes when, because of this heaviness and tingling and numbness, they just cannot go on. They just cannot go on, and they have to stop. Some of them realize that if they bend forward and walk, then they can carry on for some more time.
I see.
But after certain time, these symptoms will come to such a degree that they will have to stop. This is what is called as neurogenic claudication.
I see.
Because when the symptoms start, they have to literally limp while they are walking because of heaviness.
Okay.
That's why it is called as neurogenic claudication.
So neurogenic is nerves which are causing this claudication symptom.
So that's why it is called as neurogenic claudication.
I see.
And as the disease progresses, the distance for which they can walk goes on reducing. So it is called as claudication distance. So in the initial phase of the disease, a person says that I could walk for half a kilometer and then would stop because of the symptoms. Then after some months, he will say, I could walk only for 15 minutes, then for 10 minutes, then for 5 minutes. Afterwards, even after standing for some time, they start getting low back pain, buttock pain, thigh pain, calf pain, heaviness, and they have to sit. Okay, typically women tell me that when they are cooking, they have to, find some support after 2-3 minutes, or they have to sit. Men tell me that when they go to shops or to banks and they are standing in a line, they have to, literally hunt for place to sit. Or people, when they go to malls, in the malls, you are standing for a long time, you are walking for a long time. These people cannot stand or walk for a long time, and they get heaviness, numbness in the lower limbs, thighs and calves. Surprisingly, when they are stationary, when they are not moving, there are no symptoms initially. In very advanced stages, even while sitting or standing, also they start getting these symptoms. But in the modern era, I don't think any disease should reach that level.
So this patient who just came to you, he said he avoided going to bus stops because he could not stand at the bus stop.
He could not stand at the bus stop. Also, he avoided going to banks. He avoided going to malls or shops. So he couldn't do his daily chores also. So, it is a very disabling kind of condition. And if it advances without treatment, then people lose control on their urination. It is called as hesitancy. So before they reach the bathroom, they pass urine.
I see.
Urinary
So to lose control on urine.
They lose control on urination. And sometimes if it reaches a very, very severe degree, it is called as cauda equina syndrome, then they cannot pass urine at all. So it is the other way around, and it becomes their urinary bladder distends with urine because they cannot pass the urine.
Oh, like urinary retention.
Urinary retention.
I see. So he was also saying that he would find shops where there are no steps to climb. Is there a difficulty to climb steps also when they have
They have difficulty in climbing steps, rather they are more difficulty in getting down the staircase. But also, of course, they have difficulty in climbing up
the stairs.
But while you are climbing, you bend forward, so the difficulty is lesser as compared to when you are coming down the stairs.
You also said that initially sitting and lying down actually helps the patient in their symptoms. Is that correct?
Yes, I think if they stop walking, the pain goes in few minutes. Not at that instant, but in few minutes.
That is because the blood flow gets restored in the nerve?
That is because the blood flow inside the canal gets restored. So you should not mistake it with the blood flow to the legs. So neurogenic claudication can also have very unusual symptoms. Like some people say that after walking for some time, they get so much weakness in the limbs and numbness and tingling that there is involuntary passage of urine and sometimes feces. This is not a normal, common symptom, but it is one of the symptoms described that after walking for some time, loss of, bladder control. Another very queer thing that is reported in men is priapism, that is erection of penis. That happens when they reach the end of their tolerance, and then there is weakness, numbness, and they get involuntary priapism or erection of penis, and which is very disabling, and very embarrassing also, because it can happen on the roads, etc. So this is also a symptom which is known to be associated with lumbar canal stenosis and part of neurogenic claudication.
Okay. So basically the diagnosis is made from the symptoms that the patients
So
come
symptoms are very typical.
and
And
the MRI supports the diagnosis.
yes, so the clinician has to be very astute. He has to ask questions which will lead him straight to the diagnosis and exclude other diagnosis. And once he suspects that diagnosis, then what we do usually is to order X-rays and MRIs. Also at times CT scan, because CT scan shows bones better, MRI shows nerves better, and X-ray can be done in a dynamic fashion, that is bending forward and bending backwards, while none of the two, that is MRI or CT scan, can be done in a dynamic fashion. So X-rays, CT scan and MRI are complementary to one another, but usually MRI is the one which clinches the diagnosis, and it shows exactly where the pressure is, the degree of pressure, cause of the pressure. And the treatment is also planned according to the cause of the pressure on the nerves there. So here I will try to show you how lumbar canal stenosis looks on the MRI. Okay, so this is the MRI of normal spine, and these are the vertebrae. You can see the vertebrae, and there are discs between the vertebrae. Okay, just behind the vertebrae there is a canal.
Yes.
This white, thing you see, that is a CSA for water in the canal, which is a normal water, called as cerebrospinal fluid. And in this cerebrospinal fluid, you will see many nerves which are freely located, freely floating, freely located. So this is a normal MRI, MRI of a normal spine. There is no compression. Now you look at this MRI. Okay, I will keep the normal MRI picture on the left hand side. I will not remove it. So here you see the vertebrae, and here you see that there is deposition of calcium, and one vertebra has slipped a bit on another, that is lower vertebra. You can see it here. This is called as spondylolisthesis, and there is a disc prolapse. Can you see this bulge? This is a disc prolapse.
Yes, yes.
And behind this, there is calcium deposition. So everything together has reduced. They have reduced the canal diameter. So they have caused stenosis or narrowing of the canal, lumbar canal stenosis, because of various factors. And the nerves, as you see on the left side, they have a lot of space. Here, nearly no space for the nerves. And mind you, this MRI is done in lying down position. So when a person stands, this further increases because the body weight gets transmitted. So you have to mentally, multiply it when you are thinking about a standing person. So this is an example of lumbar canal stenosis, and this is how lumbar canal stenosis looks like. Here is another example. Here there is no spondylolisthesis, but the canal has reduced in its diameter at all these levels, and the nerves are severely compressed. We operated on both these patients, the previous one and this one, and we set right the spondylolisthesis, removed the calcium, and in another person just expanded the size of the canal, which allowed them to get cured from the problem, and they are walking for many kilometers now.
So that means whatever is causing the narrowing has to be removed.
It has to
It's
be
a
removed.
mechanical thing. So
It is a mechanical thing, but it has to be diagnosed very properly. One has to be experienced in not only diagnosing this problem, but also experience in deciphering which of the compressions are likely to be causing the present symptoms and treat exactly those compressions.
right. So actually then it becomes very logical that, non-surgical treatments may not be really helpful.
See, initially people try, non-surgical treatments, especially what we call as strengthening of the abdominal muscles, which puts the posture in slightly flexed position continuously. So that increases the size of the canal. So, initially it could help. And I have seen many people suffering greatly, literally, and, just carrying on because they are afraid of surgery. They have not been explained properly how the surgery takes place. and how early mobilization is possible. Because in today's era, after most of the surgeries on lumbar spine that we perform, we can make the person walk within 24 hours and climb stairs within next 24 hours. So, early ambulation is what we aim for. So many people think that after such surgeries, they have to lie down, there will be bed rest for months together. All these impressions are directly carried from generations before, and they are perpetuated by many people around them. So unfortunately, what happens during this time where they are not getting treated is that the nerves get damaged, and the recovery that is possible when done in correct time frame is not possible.
That also gets delayed.
Yes.
So while they're deciding when to undergo surgery, there may be other issues at home so they need a little time. Is there anything that they should do or anything that they should avoid during this time?
So I would, advise, and I usually do advise people, if they want, surgery done after 2 months, I tell them to strengthen their muscles while sitting in one place. For example, you go to the gym and strengthen your muscles so that when physiotherapy starts or walking starts after surgery, your muscles are already strengthened. Now the problem is that it is difficult to strengthen these muscles on the other hand, because the nerve supply is not normal. So, as far as possible, you should strengthen your muscles. You should not stop walking.
So by strengthening, we don't mean lifting weights. We just mean using TheraBand or something.
Gentle strengthening under supervision is required.
Correct.
And without making it complicated, even walking or climbing up the stairs is good enough. Climbing with slightly forward hunched posture can allow them to walk and strengthen their legs. But eventually they will need surgery. The reason for surgery in these patients is not only to relieve the symptoms, but to improve their quality of life.
Exactly.
So that they can walk for a longer distance without pain. So if they are suffering from other disorders like diabetes or blood pressure, walking is essential. So entire health gets benefited by this surgery. So that is what we have to remember, because this is a disorder of people more than 50 years of age usually. So they are likely to have other bodily problems, which can be treated indirectly by this surgery, because this surgery makes walking possible.
So when we advise surgery to these patients who suffer from lumbar canal stenosis, the first question that comes on their mind is it risky?
So if you talk about risk, any human activity is risky. Even taking medicine, which is a chemical, is risky. Okay. I always tell my patients to compare the risk of not doing surgery with the risk of doing surgery. Because not doing surgery is going to progressively make you chair bound and then bed bound, and also going to affect the power in your lower limbs. And you can end up with partial paralysis of your lower limbs and the urinary bladder affectation in the worst case scenario. So also, as you are not able to walk, the other disorders in your body like diabetes, blood pressure, they will increase. Your socialization will go down. Your life will be restricted to sitting in a chair with pain. So this itself is a risk. Not doing surgery can lead you to this state, and this itself is a risk. Now doing the surgery, if it has got 0.25% risk, this risk is nearly 90%. So you have to compare the risk of doing surgery by not doing it.
So it's a simple equation of losing independence versus gaining independence.
Absolutely. So it's not as if only surgery has risk. Not doing surgery itself has a risk. And if you realize it late, then it cannot be reversed. So that has to be understood properly. And then, one has another thing that one can do to reduce the risk is to be sure that they are getting treated by the team which is experienced in treating these disorders and using the best of the modern technology in treating these disorders. Best of the modern technology doesn't always mean laser or endoscope. No.
I know.
Every kind of, spinal problem needs different treatment. So to insist that a disorder which needs to be treated by fixation and microscopic method, and to insist that you treat it only by endoscope is in a way stupidity, because we are not choosing the method, because methods are different. We are choosing the end result. So end result is possible only with one method. Then if you insist on another method, the result will not be the same. So one has to also understand that.
So what generally is the time frame for recovery from spine surgery at your center?
See, generally, when we operate on these patients in time, that is when they are walking for at least 5 minutes at a stretch, then on the first day we make them walk, on the second day we make them climb the stairs, and after that we ask them to slowly increase their walking distance in quarter kilometer installments, like start with quarter kilometer, then increase it to half a kilometer, then 3/4 of a kilometer, then a kilometer, etc. And at the end of 2 or 3 months, they should be walking around 2 to 3 kilometers, provided that they were walking that distance, previously. So, there are some people who tell me that we are now walking for 8-9 kilometers. So it is surprising for us also, but they were used to that kind of walking before, so they have started again. So they have regained their original life.
So people who like to exercise before can get back to that entire thing.
Absolutely, they can start exercising. They can start doing their daily activities, going to social programs. They can go to malls, to banks. They can go shopping, because they can stand for a long time and walk for a long time.
So it looks like there are actually no long-term restrictions if all parts of the surgery go as per plan.
No significant long-term restrictions. In fact, they can do many more things. Actually, it is the other way around.
And successful outcome depends on a good team operating and the timing of surgery.
Yes,
that the
timing
patient
of
also has to
surgery,
decide
a good
when.
team, a modern technology, and as you said, the surgery done in time, in a proper time frame. That is very important.
Okay.
And generally, if you ask me about outcomes, not going in the details, because there are different reasons for lumbar canal stenosis, and every reason has, every cause of lumbar canal stenosis have different, percentage outcomes. Generally, if done in time and properly, 99% patients get well. 99 is a huge number, and people should be aware of this.
Wonderful. Thank you very much for shedding light on this difficult topic of lumbar canal stenosis.
Thank you. Thanks a lot.